man you're about to meet was like most 16-year-olds, worried about sports and school until his diagnosis. He had a rare cancer. Coming up on today's Morning Medical Update, how the treatment meant to save his life only made things more complicated. Good morning on this Monday. It's January 30th. I'm Jessica Lovell. Welcome into the Morning Medical Update and to the Dolph C. Simons Jr. Family Broadcast Studio. Life-saving treatments can come with their own complications. Today, we'll hear what it's like 15 years after beating cancer. Get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to all of those right there on your screen. But first, in our Monday morning rounds, the Kansas City Chiefs are headed to yet another Super Bowl. Hope everyone got a little bit of sleep last night. We're following the new unofficial mascot of Chiefs Kingdom. You've probably seen Nikki Conrad, a.k.a. Casey Potato Girl. She was photographed at Arrowhead eating a baked potato right out of her pocket. This was during last week's game against Jacksonville. She turned the tables on a Jaguars fan who expressed his disgust on Twitter. Nikki created her own account just to show that she caught him taking that picture. Yes, busted. So let's bring in Sarah Kostelnik. She's going to drop some potato knowledge for us. Okay, she's a board certified sports dietitian for the University of Kansas Health System. Sarah, good morning to you. Some people don't really think of potatoes as being like super healthy, but they can be, right?
Oh, absolutely. I don't think we give potatoes the credit that they deserve. They're actually a super nutrient-dense food option. Nutritionally, we categorize it as a carbohydrate or a starchy vegetable, and botanically, just the way that it grows, it's a vegetable, and so it's actually full of potassium and vitamin C and iron, and so I think potatoes can absolutely be a part of everyone's daily eating pattern. It's just, moderation and balance are keys.
All right. So yeah, it's all about the way you prepare the potato. So does it have to just be baked, nothing on it, pretty boring, or can we add some fun stuff?
Oh no, you can make it as fun as you want to. One of my favorite ways to prepare a potato is in the air fryer. Just make some at home, nutrient-dense fries, throw some olive oil on it for healthy fats, and then season it with whatever your heart's desire. I prefer thyme and onion powder and garlic powder, so they definitely do not have to be boring.
Okay, I like cheese and bacon, but I also like broccoli. So, hopefully that's some type of balance. Okay, I want to ask you, you're a registered dietitian and on top of that, a board certified sports dietitian. Help us kind of understand the difference.
Yeah, so sports nutrition's different than just nutrition for the general population because now we're really working within the intersection of nutrition and human physiology to effectively meet the fueling and the nutrient demands of athletes and active people, because that's going to be very different than just the general population. With the people that I work with, my patients, it's not uncommon for me to be giving very, very high calorie fueling plans to those athletes to just, replenish the energy that they're expending during their activity. And then additionally, we always worry about, maintaining muscle and joint integrity as well as preventing injury. And so I also see a very high prevalence of disordered eating and eating disorders within this population. So it's also crucial for me and for sports dietitians to have training in this area as well, just to make sure that all my patients are able to achieve their goals, but also maintain a healthy relationship with their food, body image, and exercise as well. And these are all things that typically we don't learn how to do in normal didactic programs in our undergraduate degree. So this comes with additional schooling, typically through a master's level degree, as well as a specialty certification training as well, which is where that board certification designation comes in.
Okay, so potatoes that I'm hearing you say, they're good for athletes, but what about someone trying to lose weight? What about just the rest of us? Are they good for you to lose weight?
Yeah. Yes, I typically call myself a food inclusive dietitian. I think the more that we demonize foods, the more that we tend to elevate them. So if we're putting potatoes or other delicious foods off limits, and that's something that you enjoy, then I think that encourages a restrictive mindset and leads to overconsumption of those foods, in a couple days, a week, whatever time period goes by until you really start to crave those things. So that's where, trying to portion it to whatever, that meal needs, a quarter of your plate, half of your plate, depending on your carbohydrate needs, and pairing it with a healthy protein and a healthy fat as well. If you can do that, then potatoes can absolutely be included, whatever your goal is, athletic performance or even weight loss.
All right, Sarah, with that, you just became my favorite guest. I love that.
Yay.
So food inclusive. Okay, let's keep that in mind. Sarah, thank you so much for joining us. We appreciate it. Okay, we are excited to share Alex Dinkel's story with you today. He survived cancer as a child. This was 15 years ago. But cancer treatment can create long-term side effects. We're going to learn more about that. Doctors diagnosed him with Ewing sarcoma after a CT scan found a mass in his head. Ewing sarcoma is the second most common and most lethal malignant bone tumor for young patients. Alex was just 16 years old. This affects men more than women. Here in the U.S., Ewing sarcoma shows up in about 4 cases per 1 million people aged 15 to 19. So let's get to our guest. Alex Dinkel is a cancer survivor who now works here at the health system. So my colleague and survivor, good to meet you today.
Nice to meet you
So
too.
glad you're here with us. Also joined by Dr. Becky Lowry, the medical director of the Pediatric Survivorship Transition Clinic, something you are very, very passionate about, and we are looking forward to learning more about that today. So Alex, I have to just ask you, how are you doing today?
Today, I feel like well, of course I'm doing great today because of the Chiefs victory.
I know.
But as far as health-wise, I am doing, I guess, as good as I can. And that's all I've ever wanted, is just to feel like I'm normal. You never really care if it's above, but you don't want to be below. And I'm just happy to be able to live a normal life, have normal days like most people. And I think that's all I ever asked for when I was sick was, gosh, can I just make myself just have normal days where I can just get up out of bed, go and breathe in fresh air, and not have to worry about getting sick or breathing something in bad. I feel terrific these days, and I think a lot of that is testament to Dr. Lowry and the Cancer Survivor Transition Clinic.
Well, and I would imagine your days you take things for granted. You start looking at days and how well you really feel quite differently, don't you, Dr. Lowry? And I'm sure you hear that from a lot of your patients.
Yeah, no, that's absolutely true. And I think Alex is right on point that our goal is to help people get back to doing the things they want to do every day, because we want to remove the burden of health-related tasks as much as we can and guide people in a personalized manner that fits their history.
Getting back to just having good days. Alex, 16 years old, you find out you have a rare cancer. Kind of walk us through when you first realized something was wrong. What were those first initial signs?
So I was doing a lot of training for sports at that time, and I was seeing a chiropractor to help just kind of keep me in line. And I went to him one night and cracked me, and I just felt a little shift or a little twitch in my neck. Next morning I woke up and my whole face was pulled over to the left side of my face, and doctors thought it was Bell's palsy initially. I'd gotten set up for an MRI about 2 weeks out. I unfortunately didn't make it. I had a massive headache. So basically what happened is when he cracked me, it pinched a nerve that set off to where my tumor was, and my tumor was located on my 3rd, 5th, and 7th facial nerves. And so it set it off, and thankfully I had that massive headache that led us to go to the ER urgently, and that was where doctors discovered the mass. And then I was transferred from St. Elizabeth's Hospital in Northern Kentucky down to Cincinnati Children's Hospital in Cincinnati. So it's a weird circumstance on how it happened, but it was fortunate because it was caught relatively early.
So you're pulled out of sports.
I'm pulled out immediately. Well, let's not say immediately. I was still doing baseball training. I was still able to do that. We knew that a brain surgery was hypothetical, and football would be taken away after that brain surgery, just because of the fragile state that my skull would be in after everything that I would go through. But I was still doing things with a full wide eye that was lodged open. I couldn't blink. Could barely even pull a smile together, and now you can kind of say I can pull it a little more after nerve grafting from my surgery. But you know, even a month or two after my brain surgery, I was still picking freshmen off in baseball practice, showing them how to do a left-hander's pickoff move on first base. So I still tried to persevere and do things that I loved while also going through adversity.
A really tough time. And you were able to keep up with your studies as well?
Yes. When I would get checked into the oncology unit, and I did my treatment a little different just due to the research nature of my trial, I was required to either stay in hospital from a matter of 3 days and nights or 5 days and nights, depending on the treatment schedule of where I was. So it wasn't like I got to just come in, get my treatment, and go home. I had to go in, stay in the hospital for 3 to 5 days, and you know, God forbid if something happened where my immune system was compromised, it would be for longer. So I would bring in just stacks of books, and these doctors and ladies would just laugh. You gonna read all those? I'm like, yeah, I sure am.
What else you got to do?
Yeah.
Right? So chemotherapy, that was pretty tough on your body.
Absolutely.
Really bad experience. Tell us about that.
So the chemotherapy treatment I received, if I can remember, was cycles of, and of course I don't know how they were done, but ifosfamide, doxorubicin, vincristine, and one other. It was intense how it was done. They were done over long durations of periods of time. Also, while receiving my chemotherapy, there was a stretch in there about 3 months in where I underwent chemotherapy and radiation simultaneously. So I would get my chemotherapy at Cincinnati Children's, and then just a half mile down the road, actually to where DeMar Hamlin for the Buffalo Bills was taken, University of Cincinnati, they would transfer me down there to what is called the Barrett Center, and I would receive my radiation treatment. They would transfer me back to Cincinnati Children's, and I'd continue receiving my chemotherapy. So, you know, chemotherapy is just kind of like how everybody describes it. It makes you feel a little weak, a little more exhausted, bruising, more susceptible to things. But I'll tell you what, they put me on appetite stimulators to help my appetite, help me eat better. Got to do your mouth rinses. I didn't do that at one point, and I'll tell you what, man, those blisters are not a joke. You gotta really listen to your doctors and follow those orders if you're gonna try to avoid the unnecessary pains that come with chemotherapy.
I bet, yes.
So I had my nurses who were like, I told you, if you don't do those mouth rinses, you're going to get those blisters all the way down.
So they kind of know what they're talking about.
Oh, yeah, they do. You want to listen to everybody who tells you what to do.
Well, so Alex, you're going through all this under the care of pediatric physicians and care.
Right.
But just like everything, you age out. You age out of that system.
Absolutely.
And then you have to go on the rest of your life with adult care. So Cincinnati, they took great care of you. Tell us about coming here and finding Dr. Lowry.
Absolutely. So Kansas has always been home for me, essentially. My dad was born and raised in Topeka. I have tons of Dinkel family out here. And Kansas was always where I wanted to go when I graduated from high school. And I ended up finding Washburn University in Topeka, which I absolutely loved. And I moved out here not even 7 days after I graduated high school, just to be out here and, you know, went through college, went through all my stuff with doctors in Topeka, but when I graduated and we moved to Kansas City, we were in the process, and actually in the Kansas City Star that year, an article about the Cancer Survivorship Transition Clinic had come out, and my in-laws who got the newspaper frequently, were like, you need to read this article on this. We think this is where you should go and receive your treatment if you guys are going to live in Kansas City. Read it, called Dr. Lowry's office. They received everything from Cincinnati Children's, and I was in there, and it was incredible because I never thought that somebody would take such an in-depth look at everything, from all the radiation exposure that I'd had, not just from the treatment, but all the CT scans, your PET scans, every X-ray, going, okay, well, gosh, you've had a lot of exposure. We want to make sure we keep that down to a minimum. Hooking me up with endocrine, making sure I'm on the right medications. Of course, my late phase effects, I had a cardiac arrest, much like DeMar Hamlin's, and you know, setting me up with a great cardiologist and Kevin Mulhern. I mean, without them, they've helped kind of juggle all these doctors that I see. I mean, it's been truly one of the best things that could have ever happened, because as a young adult transitioning that's a lot to take under. That's a lot to reach out and go, well, I guess I need this doctor, or who should I reach out for this? Dr. Lowry's going, well, let's take a look at all the things that you're experiencing and let's go from there. And it's even been throughout the years, something dermatology winds up, let's check your skin. We want to make sure you're not at second risk for a melanoma from the radiation exposure and everything else. So it's been really big blessing for me and my family.
Dr. Lowry, I think the key is transition, because I would think so many things would be missed if the burden of a pediatric patient having to transition alone over into this new world of care, that there might be things that might get missed. So tell us a little bit about this is all through University of Kansas Cancer Center, the Survivorship Transition Clinic, how it came about, where you found that there was a serious need here to make sure that these patients were carried on through the rest of their life.
Yeah, absolutely. So I think that you hit the nail on the head in saying transitions, because patients just like Alex are navigating so many transitions as we think about moving from the pediatric to the adult care world, as we think about moving from acute cancer treatment to back to primary care and survivorship care. And how we do that really needs to be very intentional, because just as Alex really articulately alluded to, there are so many unique pieces of his health journey, of his care plan, that are unique to his specific agents. My patients have heard me say often, and Alex and I have talked about this, we wish we had more unicorn medications and things that were only helpful and not detrimental in some way. And the reality, as we all know, is that that's just not the case. We have such effective medications for cancer treatment right now. It's an incredible time to be working in this area, but those agents that we use, whether it's radiation or chemotherapy, they all have things that are unique to the health of that individual going forward. And so our goal is to help each patient understand what their unique treatment history was. Alex is so articulate and so knowledgeable about his history, but as you can imagine, for many of our patients, when they experience this in childhood, it can be really difficult, even for adults, to understand and be knowledgeable about all the elements of their health. But if you think about going through a complex care event when you were a child, that's a lot to learn to manage. So Alex does such an incredible job of staying on top of that. But certainly our goal, as he said, is to help make that as seamless, as frictionless as possible, because navigating healthcare can be overwhelming. It can be challenging.
Sure can. Who's eligible?
Great question. So we see patients who are 18 years and older who have had a history of cancer in childhood or young adulthood. Interestingly, that definition actually goes up to age 39. So there are some patients who might have, for example, like a Ewing sarcoma, but they may not have been diagnosed until, say, their mid-20s, for example. And that is a malignancy that we think of as being more of a childhood-based malignancy. And so we have patients like that. Most of our patients were diagnosed in childhood. All of them are over the age of 18. And as you alluded to, there's less than 100 actually adult dedicated centers like this in the country. So we're really, such a privilege for us to have an opportunity to serve in this clinic and be surrounded by experts and subspecialists in the field. And the greatest privilege is the opportunity to work with patients like Alex.
Well, literally work with patients like Alex, because full circle moment, you now work for the Cancer Center and you are surrounded by people who have been where you have been. How has that helped? How has that helped you work with them, better empathize with them, and just really be there with them?
When I landed in clinical research, and it's been almost 8 years I've been in clinical research, and I've been at KU for the last 4.5, when I first fell into it, I really was intrigued by the site option and being on site, knowing what it's like for patients again, and knowing what it's like for them when they're actually recruited and going through this whole process. Mine was just kind of a spur of the moment thing, I guess, when I felt like when I was on my clinical trial. For patients that are on this, it's scary. It's scary to hear you're told cancer. We see the social fear that comes with, oh my gosh, I have cancer. Oh my gosh, I'm going to be bald. Am I going to be sick? What is going to happen? Am I going to survive this? And there's, of course, the constant questions of why, how do I fight? How do I beat this? And who's going to be there to help me navigate this crazy world of research and trials? And I think we get a lot of patients that are overwhelmed with that. My first 3 years here, I worked in regulatory department, and I would write patient consent forms, help write protocols, modify those protocols. And the biggest thing that I think the FDA did as a wonderful thing was the first part of consent forms, making it readable to about the 6th to 8th grade reading level, making it in basic terms that patients could understand and go, okay, I get the gist of what's going on. Then giving them the full scale of, okay, here's what's going to happen on this week, and this week. And we make them aware of what's going to happen, what the major side effects are, what the adverse effects are. And that's a big part of what research is the adverse effects. I mean, is it bad that I had, a sudden cardiac arrest impartial due to my chemotherapy? Absolutely. But are they more knowledgeable for it now and going, we know what we need to test for. How do we prevent this from happening to a patient? Mm-hmm. Literally, mine was 6 months down the road from, I was like, oh, done from cancer. And then late phase effects, and that's why we follow up with patients. And I think that's, doing the phone calls that I sometimes call our patients for a number of trials that I have, just checking just to see how they are. And I'm sure I talk a little more with them than most because, I understand the situation of where they're at and what the perspective is of, there's that little fear after you are told you're a survivor now. And it's just like every scan from, that 3 to 6 months, you get nervous again. And then you just get a little further out. And each year it's half a year of scans, every 6 months. And now it's annual. And you're like, okay, I feel a little better. I feel a little more like I can live life and go on. So being a part of that in just a small way,
it's a big way.
It is.
It's a big way.
I appreciate that.
I want to talk about something though positive. So there is kind of a fun positive to being a pediatric patient. You get to do Make-A-Wish.
Absolutely.
Tell us about your Make-A-Wish wish, well, what you wanted and you didn't get it.
I was initially a little headstrong on mine, and I try not to say that was a double entendre. I really wanted to go skiing in Vail, Colorado. I was a big skier previously to my treatments and everything.
You also asked for Italy.
I also asked for Italy.
Hey, you gotta ask.
Yeah, I know.
I would too.
It's hard not. I watched a lot of The Godfather and The Sopranos when I was in treatment, and just like that rubbed off on me. And I'm like, oh, I just would love to go see that. And they're like, Italy, it's a little far abroad. And they're like, in Vail, they're like, you just had major brain surgery 6 months ago. You are not.
Bring it a little closer to home.
Yeah, you're not going down a mountain. My family, we are diehard Jayhawks. I've been a Jayhawk since I came into this world. Mm-hmm. My dad played 4 years of football at KU, as well as my uncle. We're Jayhawk fans, and so we followed KU that whole year, that big 2007, 2008. Oh, man, it was a terrific season where they went 12-1, and when they got their bid for a bowl, I couldn't help but just not be like, I want to go to the Orange Bowl. I want to go to the FedEx Orange Bowl, and I want to see the Jayhawks win. And it was.
Now that they could do.
They
made that happen.
They did, and they played their heart out this year at this next bowl game that they played, and we follow them every year, and it's just, I couldn't have been more happy. And they were like, really, just the Orange Bowl? You don't want to go to Disney World or Hawaii? And it's, no. I want to go see KU play. So
love it.
That's where I tell people, like, I might not have graduated from KU, but I'm about as diehard as you can get.
Yeah, you are definitely born into it. You are definitely a Jayhawk. Okay, some cool things I want to talk to you about,
Sure.
and they're very Cincinnati Bengal related. Stick around for that. And then your wife's having a baby.
You just spilled beans. No,
I thought I was supposed to say that.
You're fine.
Oh gosh. Okay. Making baby announcements. Okay.
You're okay.
Okay, thank you.
You.
Okay, let's turn to infectious disease physician Dr. Wissam El-Attorney. Dr. El-Attorney, get me out of this mess. Please help me. Good morning to you, by the way. How are you?
Good morning.
Good to see you. Let's get to some COVID counts, and I've got a headline I want to ask you about.
Okay, so as of this morning, we have about 50 COVID cases in the hospital. 25 of those are active symptomatic patients, and 6 of those are in the ICU. All of the ICU patients are on the ventilator. So we have to remember COVID is still with us, just like the other respiratory viruses, influenza and RSV this season. Fortunately, the number are going down nationally and stable at KU as far as hospitalizations. So keep your precautions for all respiratory viruses. The same precaution work for all viruses pretty much. And there are vaccines for COVID, including boosters. There are vaccines for influenza. There are upcoming vaccine for RSV.
So our message just, it hasn't changed. Dr. Alatrini, are you surprised at the numbers this far out from the holidays? You know, we're a month away from the holidays. Is this kind of what you would have expected to see when we look back over the last couple of years?
Unfortunately, COVID remains an unpredicted virus. The other respiratory viruses are more seasonal. Influenza typically is a winter virus. We rarely see it, although there have been exception years where a new strain comes up and pops in the summer. But typically it's a winter illness. But COVID has been all year long. The numbers go up and down. We've seen major surges in the winter, but it just continues all year long. So I'm not too surprised yet. I'm hoping it will become a seasonal virus where you're seeing it and you can time your vaccine before the surge. That would be an ideal situation, but we're not there yet.
But you said it, get the vaccine, get boosted if you can. Dr. Alatrini, thank you so much for standing in for Dr. Hawkinson today. We appreciate it.
You're welcome.
I see if there's any reporter questions on the line. And before we get to our community questions, if we could hold on that for just a quick second, I do want to ask Alex, you have this amazing connection to Cincinnati because they took care of you as a pediatric cancer patient. We love them for that. Your father played for the Bengals.
Yep, my dad played, was drafted in the 5th round by the Bengals in 1978. He spent, I want to say, six or 7 years with Cincinnati Bengals. Was a special teams captain.
Is that your dad in the picture with you at the Orange
Yes.
Bowl? If we can pull that up. Okay, so tell us about our new favorite Bengals player.
So my dad was of course, KU Jayhawk, played from 74 to 78. You know, was very fortunate to get drafted to the Bengals, and he actually went to the first Super Bowl with the Bengals in Super Bowl 16 against
Joe Montana.
Joe Montana. So another Chief great. So we definitely had our ties, and I even talking to him about the game and going, you know, he's like, who do you think I should pull for? I'm like, I don't know. Who do you think? He goes, well, I've been a Chiefs fan since 1963, and he's like, I do like the Bengals. He goes, but I very much like rubbing it in their nose when Chiefs win.
So what was it like last night in the house?
It was
texting and calling. What were you guys?
So it was very ironic because I do love Skyline Chili. I mean, I love barbecue. That is very much my Kansas City heart, but I do love Skyline Chili so much. And they just came out with these socks that had the Bengals logo and chili all on them, with the chili dog. And I got them in the mail right as the game started, and I was like, this can't be a good omen. I was really...
Did you wear them? You didn't put them on?
No, good.
Okay.
I had my Mahomes jersey on. I was like, I told my wife, I was like, you need to hide those somewhere before this game starts. I was like, we really can't be having these out.
What a cool connection.
So,
did you know that his dad played?
I did not know that. I did know that Alex is quite a knowledgeable sports fan.
He is. He's full of all sorts of good stories. I know we could keep you here all day. Let's get to some community questions, though, if we can. Lisa wants to know if the clinic is your primary care physician, or do they work alongside with your doctor? So does Alex see somebody else and then alongside you, or is it a direct line to you?
Yeah, so that's actually such an interesting and good question. Alex happens to also follow with me for his primary care. We have had the great gift of having the clinic grow quite exponentially over the years, and so we follow with many of our patients alongside now their primary care physician. And a number of our patients come with established primary care relationships with a physician, maybe in the community or at another hospital, and we certainly want to be respectful of and not disrupt those existing relationships of continuity. So we follow a number of our patients in parallel with their primary care physician.
And that probably makes them feel really comfortable too.
Yeah,
to make
we
sure
hope so.
Everyone's in step. Sarah wants to know, what does follow-up care look like, and how long can you be a transition clinic patient?
Yeah, another good question. So the short answer is indefinitely. So follow up for issues related to cancer treatment, just like issues related to family history risk factors or other risk factors that individuals may arrive to our medical care with. Those specific health-related monitoring issues go on indefinitely. So we have the great privilege of following many of our patients for decades.
Jim wants to know if there's any risk of a cancer like what you have, Alex, of coming back. Is that a risk, or is it a minimal risk?
Oh, me? Oh, I was gonna say,
either jump in.
It is a big risk. I have known several other Ewing survivors back home, and they unfortunately have had secondary and in some cases third malignancies. Ewing's is known for coming back in the lungs, which is very strange. I'm not too familiar as to why, but when I was going through all my imaging and scans, they did find 2 tumors in my lungs, but they were both benign. So that's why every year I do a head and chest CT, because they are very aware that, okay, you've had tumors there before, so let's watch that area. We still watch the head. But yeah, we're very much at risk. That's the same reason why I said Dr. Lowry has started to take concern in, hey, we need to probably have you see a dermatologist. Let's make sure, you know, your skin's taken care of. Let's check all those areas. So, of course, there's always risk for secondary malignancy.
One of the things I might add, and I think that Alex is doing such a nice job of articulating the difference between those, but there is, when we think about cancers, there is a recurrence of your original cancer, and then there's what we call a secondary malignancy. So patients who have radiation history, for example, have risk of malignancies different than their primary or original cancer that are secondary to their radiation treatment. So if their radiation treatment was in the field of the chest and they're female, for example, they have an increased risk of breast cancer, and so we adjust their screening specific to that. If they had radiation to the field of the abdomen, for example, their risk of colon cancer is higher than the average population, and we adjust their screening specific to that. So there's both recurrence of the primary and monitoring for secondary.
Jerry wants to know how large the tumor was that they removed from your head.
A little smaller in the size of a golf ball, if I'm not mistaken. It was a golf ball, grape, something with a G, but I know it was a good say. It was intertwined between my 3rd, 5th, and 7th nerve. And I believe also one of my arteries was right there, and I know that was a complication as to why they could only remove 98% of it. And if I'm not mistaken, on the ct.gov or its NCI website, my brain surgery was one of the first that was U.S. based. It's on there as I was one of the first U.S. with the Ewings of the petrous temporal bone. It's always kind of strange looking at it because you're like, oh, look, there's the inside of my head. But it's, you know, it was a very unique case because Ewing's is normally, and this is one thing I did want to say, it goes after the extremities, and everybody I've known has had it in femur, tibia or fibia, you know, bones like that. Mine was very unique. Everything was right up and in here, and so when they did have to remove that, and then of course with radiation therapy to try and get the rest of that, that was another big adverse effect. You know, as much as radiation treatment was a blessing, it was also a double-sided curse that fried my pituitary, my adrenal, parts of my thyroid glands, and so that is medicines that I'm on now to help try and give me the balance that I need for my body to be able to do what I need to do. And especially when I was in college having to take and still take testosterone because I don't produce that necessary amount. I'm working with our endocrine team, and they help me, you know, fulfill that void. But even during college, taking human growth hormone to help, I just would get so exhausted during college and just so lackadaisical, and that would help at least give me the energy. So again, serious adverse effects from just that.
Gosh, I'm so glad you work here. He knows a lot, and now you work with our patients. They must be, they're just in good hands with him, I feel like, right, Dr. Lowry? I mean, 100%. Is it typical to have somebody be able to walk away with all this information, retain it, and then be able to give it right back?
No, Alex is unique.
He is unique. Just like the tumor, you are very unique.
I say, I can retain this information, but my wife would say that I can't retain.
She would have a different story.
Yeah, she has a very much different.
I want to get to final thoughts here in just a second, but question for you, Dr. Alatruni. One of our listeners, viewers, wants to know, notice that you said 6 people are in the ICU and 6 people are on the ventilator. That seemed a little alarming to her. Help us understand in comparison to, you know, other months or this time last year. Is that normal to see everybody that's in the ICU on a ventilator? People always want to know if those people are vaccinated. We don't know that, correct? So could you just talk us through that a bit?
Yeah, correct. I don't have the information about the vaccine status of the 6 people intubated in the ICU. It's a little bit more than expected, I would say, but that's a reminder for us that COVID is still a bad virus, even though the percent of complication have significantly decreased now from 2020, where we had 10% hospitalization or severe disease. Now it's down to 1%, as the majority of the population has been exposed somehow, either through infection or through vaccination. But there are still a fraction of the population that still have not been infected and have not been vaccinated, so that's to keep in mind, in addition to people with weak immune system that could have been vaccinated, just did not have a good response to vaccines. So we could still see severe disease up to intubation in the ICU.
All right, let's get to final thoughts from our guests. Alex, I'll start with you. Anything else you want to share with us today?
You know, one thing that I know we had discussed a little bit previously is for new patients that are diagnosed and the fear that comes with that. Even as a parent going through this, you would ask me, you know, what's some advice you would give to parents? You got to go toe-to-toe with doctors. I mean, you got to be willing to ask the questions. You've got to be willing to push and not be afraid. I think the one thing that I learned since I've been at KU is, and I think this is just because of where we see doctors as they are the ones who are going to save us. You're going to help me. You know, when we put them so high up that we're afraid sometimes to interact, that they're human beings just like us. They're people just like us. They have fear. They have doubts. They sometimes need the, you know, hey, I got a question. And it's like, oh, that's, you know, presentable. So don't be afraid to push and ask those questions and ask those hard questions to doctors, because at the end they're just like you and me. They want to help. We want to help our, you know, our friends and family get through it, and they want to help you get through it. So I think that's one big thing that I would like to point out is don't be afraid to just push the envelope and just go, you know, are we doing the right thing? Should I seek a second opinion? Should I do this? I don't think doctors are unafraid or afraid to say, you know what, let's do something different. Let's try this. You know, it's a very working relationship, and I think a lot of people have that viewpoint of it.
Yeah, and it's great advice, especially for parents embarking on this really scary, unknown journey with a child. It's a good way to leave it. I appreciate that, and thank you for being so open with your story. Thank you for giving back to our patients, and we're just glad to have you. And thank you for becoming a Chiefs fan.
Oh, absolutely. I know I was very fortunate this year. Dr. Lowry asked me to be a part of the Crucial Catch campaign with the Chiefs, and that was something very exciting that I just thought it was lunch. That's what her nurse navigator, and we don't give enough credit to Kyla Alsman, her nurse navigator who works between Children's Mercy and KU, as well with the Masonic Cancer Alliance at MCA. You know, she just called and said, "Hey, Dr. Lowry would like to know if you want to be a part of this. You know, so it's a luncheon with the Chiefs." And I was like,
well, duh.
Okay, and then I'm like, oh, this is cool at the Chiefs facility. We'll see them practice. And then in walks Andy Reid, and I'm just like, you didn't say it was this. You didn't say we were going to be meeting people. And oh my gosh, it was a really awesome experience to be a part of that, and then to go onto the field on the Monday night game. So I'm just grateful for everything that they've done for me. It really is a big full circle moment, and it's a very great team that really gives me the ability to really live my life to the fullest. So
that's you and your team, Dr. Lowry. Final thoughts.
I tell you what, the privilege is absolutely all ours. Alex, as you can tell, is a unique and special human. I think my final thought for our patients would just be that each of us has a unique medical blueprint, or should have a unique medical care plan. And so to Alex's point, we encourage patients to ask questions and to partner with your care team to develop an individualized plan that fits your unique medical needs.
And where do people find you?
They can reach out to the Cancer Center Navigator team, and we have patients, physicians or primary care physicians who reach out for them. We have patients, just like Alex did, who reach out on their own, and we have doctors within our own team that can help connect us. So we're happy to connect with patients however it works best for them, but the easiest way is to call the Cancer Center and ask for the navigators.
Thank you both so much. Great information today. Dr. Alatrini, final thoughts from you.
Again, I want to thank Alex for sharing that story. I think it's great to have specialty clinics at KU, and especially in areas like post-cancer and recovery that primary care physician might not be comfortable with following these patients. So Thanks again.
Always good to see you. Thank you for being with us. And thank you for being with us today. You can catch our updates anytime by logging back on to Facebook, YouTube, and Twitter. Tomorrow is another encore presentation of the Morning Medical Update. And then Wednesday, we are back live with open mics with Dr. Stites. Till then, have a great day. Tiny machines that pump your blood, doing the heavy lifting for your heart. I'm Jessica Lovell, coming up on the next Open Mics with Dr. Stites. Our doctors break down the promising new research into LVADs, a device that pumps blood for your heart, and the first ever look at how patients can live for years with a heart implant.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.